Hello, this is Dr. Castanet. Today I'm coming to you with another lumbar MRI scan and a case study. This is a 78-year-old physician who came to me. I treated him 6 years ago for sciatica, and he's been doing reasonably well since then. But he had a recent recurrence of his sciatica. He said from lifting his grandkids and carrying them up a staircase. So he came back to me. I've treated him, I think, two or three times so far, and he's not doing a great deal better, so I went to get this MRI scan today. This has changed from his previous MRI scan of 6 years ago. You can see here on this MRI scan, he's got an extrusion of disc material, so that's when the disc material herniates posteriorly and then migrates either inferiorly or superiorly immediately behind the vertebral body. I think this occurs under the posterior longitudinal ligament. Although his is off to the left side, which you'll see shortly. This is not a mid-sagittal image. It's not right down the center, so it looks a little narrow here at all these levels, but this is off to the left side. His sciatica is on the left side, so he looks stenotic at this area because of the herniation, the extrusion, and the ligamentum flavum here. At this level, you can only tell a hint of a spondylolisthesis, but it's noteworthy, but it's not of any clinical consequence, I don't think. His complaint arises solely from this. The rest of the levels look pretty good. Not a bad looking spine for a guy that's 78. Let's go to the next image. This is a cross-sectional image at the L4-5 level where he had the extrusion. You can see the extrusion here on the left side. See all the little nerve roots there, the little dots. You have all this white area which is open on the right and back here and centrally, but over here on the left side you've got this extruded mass here, and that's compressing the nerve root there, probably the L5 nerve root. You see also here some atrophy and fatty infiltration in the multifidus muscles, both sides. Let's go to the next and last image. This is a sagittal image. Again, T2 weighted, but I changed the contrast a little bit because these images were rather dark, so I try to lighten them a little bit. And you see the same extrusion right there. And the little hint of a spondylolisthesis there. So nothing particularly new here. This physician was concerned. He talked to the radiologist immediately after doing an MRI scan, and I think he's not that familiar with MRI scans, this physician. Doesn't read them himself typically, so he was confused. He thought the radiologist told him that he had a fragment. A fragment would be if a piece of disc broke off, it's free in the neural canal. Sometimes that doesn't matter because it's not that symptomatic. Sometimes they get resorbed by the body. If the pain's not too bad, in any case, whatever the exact morphology of the disc lesion, they can be resorbed oftentimes if you can deal with the pain. Time will typically improve these things enough that you don't have to worry about them. But I think the radiologist scared him. So he brought the CD over to me, and I said, look, you have an extrusion. I would call it a moderate amount. It's not severe. I've seen a lot worse. These things generally have a reasonably good prognosis, like most disc lesions. They'll probably shrink over time, and he'll probably be fine again, as he was, if he can wait it out. But I think he wanted to talk to a couple of neurosurgeons, and I'm certainly going to facilitate it. I never get in the way of patients doing what they want to do. I'm here to help them, and I don't want to do anything that seems to serve my self-interest and undermines any credibility or trustworthiness I have in the patient's eyes. So I referred him to a neurosurgeon that I have worked with before. He will probably reassure him. But again, if the physician is having a lot of pain, and by the way, Clinically, he does have some weakness. He had some weakness of his extensor hallucis longus and his tibialis anterior, so some weakness of the L5 innervated muscles. I would grade him probably 4 out of 5. So he has some concern. He also has some pain and tingling and numbness of the lateral leg. So I'll let the neurosurgeon evaluate him. He'll see and get 2 opinions. I think he wants to know, since he's concerned about this worse appearance on MRI scan, he wants some reassurance that nonetheless this is not surgical, and he wants to hear that from surgeons. So I think that's fine. And, you know, surgeons could offer him surgery. There's certainly something you could get rid of here. But this onset was about 2 weeks ago, and probably they're going to tell him, look, you don't have cauda equina, you don't have progressive neurologic deficit. This is not a bad-looking lesion. It'll probably get better on its own. Go do pain management, meaning he can try epidurals. He's reluctant to do epidurals now because when I saw him 6 years ago, he had done an epidural, didn't help him at all. And it did help him, I'm sorry, for about 2 weeks, and then it was just as bad as previously. So he came to me and I treated him, I think, about 15 times altogether, and it did resolve his complaint for 6 years, and he sent me a lot of people since then. So he knows firsthand that the treatment of spinal decompression is very effective for most people, himself included. In any case, he's going to see the neurosurgeon today and get a surgical opinion. So that's as much as I have to say about this. I think I'll probably continue to treat him as I did last night when I reassured him that this is in all likelihood not surgical, no reason to not stay the course in conservative treatment and continue to do the spinal decompression that I think will get him out of the woods again and get him back to recovery, even though this lesion looks like it worse than it did 6 years ago. But I treat these all the time, and they typically will get better, and in part from my treatment, and in the long term because of some resorption of the disc as well. I'm Dr. Castanet in Decatur, Georgia. If I can help you, call me at 404-558-4015. If you'd like to learn more, you can go to my website, backstrong.net. I post all these instructional videos and more on a variety of neck and back related topics on my blog on my website. And you can go from my website as well to my YouTube channel, where these are also posted, and many others on everything from surgery to pain management to ergonomics to don't use a pillow and other interesting topics. Thanks very much. Bye-bye.